Zion, dear Zion, home of the free.
This Defending Utah presentation is brought to you in part by our generous sponsors. This is Ben McClintock here again with Defending Utah, and we are joined in our studio here with Aaron Monson, the Chief Operations Officer of zdirect.care and Riverton Zenith Family Health. Appreciate you joining with us.
Thank you. Glad to be here.
So this might start off looking like a commercial, but I promise it's not. We haven't asked, and there's no compensation being paid to Defending Utah for this interview. But even though we've got this company talking here, it's because it's a solution oriented to the problems that we're facing. We talk a lot about the problems that are facing the state of Utah and a lot of the tyranny that's going on with the government attacking our liberties, especially with health care. You've got Obamacare, and then you've got this new government health care being introduced by the Republicans. But it's more and more of government health care. And we've talked a lot about some of the solutions being nullification. And in a way, this what they're offering here at Zenith Health Direct Care is kind of like a nullification. So first I want to talk about kind of what led you guys up to this, how, kind of the same thing of you've seen this more and more government intrusion on healthcare and families and that kind of stuff. So talk to us a little bit about that.
Okay, well, first of all, from the provider aspect, in other words, the doctors providing the care, to give care through the insurance-based system, the health insurance system, has become so muddied that it really takes away from good care. And with the advent of Obamacare, where we've been forced to carry health insurance, it just made it that much worse. So this is an attempt to work outside of the system and say, okay, we're just not going to do insurance anymore. Okay. The common misconception today, and especially with our politicians in Washington, is that health insurance equals health care. And that's just not the case. And even as consumers, we can see that. You go to the doctor and you find out, after the fact that this particular service was covered, this one wasn't, kind of thing. And there's a lot of smoke and mirrors associated with that. Even the doctors don't know exactly what they're getting paid. All they know is that there's massive amounts of red tape associated with accepting health insurance. And the direct primary care movement is all about just saying, we're done with health insurance. We're just going to collect money directly from a consumer, cut out all that overhead associated with taking health insurance, and pass the savings on to the customer, as well as much better care.
So coming from that health provider aspect, what are some of the problems that you guys face with regulations kind of getting in your way to providing the best health care you can?
Well, if we're going to answer that, I have to kind of approach the question from the perspective of what we go through to take health insurance, okay? On the doctor side of the equation, in order to accept a particular insurance company's payments to take care of their membership, we have to be credentialed with them. Okay, that's the start. That's usually a 2 to 3, 4 month process sometimes, going through all their red tape to be on their panel, part of their network, so to speak. And it takes a huge amount of staff labor to get that done, okay? Additionally, we have to go through and negotiate every single CPT code, okay? Now, ICD-10, which is the latest iteration of this, there's about 65,000 codes, billing codes, right?
And you've got that all memorized, right?
Well, not quite. Now, thankfully for us, we're in family practice, and so, our subset of that is roughly 400 to 500 codes.
Still.
But take that times the number of health insurance companies out there where we have to go through and negotiate every single CPT code and agree to what the insurance company will pay us, okay? That process has to take place every couple of years. And it starts almost always with what Medicare pays. Okay, that's sort of the baseline, right? And so indirectly, the government influences what the insurance companies will pay, because they always start with what the government pays us through the Medicare program, okay? It's a ridiculous process that we have to go through every couple of years to be able to participate with insurance companies, okay? But now you get down to the care part.
So not just like Medicaid, but just and Medicare, dealing with them, but dealing with the insurance companies.
Correct.
Is a big, yeah.
Correct, right? So then you get down to the actual care transaction itself, and the way it works, the patient comes in and we perform all these services, and we have to know what billing code to use, right, to sort of put it into a language that all the claims processing folks understand, right? So we send it to the insurance company first. And a little side note, we bill sky high for that.
And they know that, so you're not like
and they
shocking.
know that,
right.
right? And the reason we do that is because in almost every insurance contract, there's language in there that says we will pay the lesser of the billed charges or what our contract says we'll pay you. And since literally, you do the math, there are thousands of different iterations of what we might get paid for a certain thing, right? Mm-hmm. And no, the doctor, the caregiver never knows that going into it. They don't know, right? So we bill sky high because we know that the insurance company is going to come back and say, no, sorry, Dr. So-and-so, we are going to adjust your bill off to what our agreement says. So they send back something called an explanation of benefits to us that says, our agreement spells out that this is what we'll pay. It doesn't matter what you billed us. And that's fine. We expect that, right?
It's part of the game you're forced to play.
It's part of the game. It's part of the smoke and mirrors, right? It's why the patient and the doctor have no idea what it's going to cost, right? So we get this EOB back, explanation of benefits. We adjust off the difference. The insurance company then sends us, excuse me, their agreed upon portion, right? Minus what we now have to go to the patient and collect, right? Minus whatever we collected up front, AKA the copay, right? Minus whatever the agreement was for the deductible, and wherever the patient is in that process of what they paid versus not paid towards the deductible, right? So 3 months later, after the service has been provided, we finally collected, hopefully, every amount we are entitled to. That process is why healthcare, at least primary care, is so ridiculously overpriced. Because we play this back and forth game, smoke and mirrors. There's no transparency, right? And studies show that roughly 40% of the cost is all that back and forth nonsense. So direct primary care says, forget it, we are not doing that. You know, Mr. Patient, Mr. Smith, Mr. Jones, pay me directly, right? Mm-hmm. And I'll provide the care. I mean, additionally, and going back to your question about the provider and the care, yeah. When there's that elephant in the exam room, meaning the insurance guy, right, the ghost in the corner, right, saying, Mr. Doctor, you cannot prescribe that medicine. It's not on our formulary. This is covered, but this isn't. You see, you've got somebody in there that's dictating the care.
So the doctor can't just think about what is going to be best for the patient.
Exactly. Exactly.
He's got to figure out how am I going to be able to
how am I going to get
justify my being here right now.
Exactly, right. You've turned the doctor into a glorified billing and coding person, right? He or she is trying to do the best he can for the patient, but he's under the thumb of the insurance company. He works for the insurance company. That's how it works, right? And so you get Obamacare in the mix where our politicians, well-meaning, said, we've got to insure everybody. So they take this broken system
They create the problem.
force it on everybody, right? Now, I don't want to give the wrong impression. Insurance is a good thing for stuff outside of your basic doctor visits. If I could use a comparison, you don't buy a car insurance policy that includes oil changes and wiper blades and car washes.
Pre-existing wrecks.
Precisely. Very good point. Yeah. You don't, it just doesn't exist, right? And yet that's what we have with health insurance. Well, to continue the comparison, primary care is all of that. It's your wiper blades, it's your oil changes. And every once in a while you get a rock chip, okay, to continue the comparison, right? You might have a broken arm. But if your family doctor can set it and put it in a sling, you're not going to go to the emergency room for that. Or you shouldn't, right? The point being, we can do primary care without insurance and save a fortune on all that ridiculous overhead. The care is better because now you have a doctor that can really focus on your care, right? Instead of focusing on, all right, how do I get him taken care of and still get paid? That's the problem with healthcare today. And Obamacare makes it worse because they're forcing an already broken system on everybody.
They've created the problem, and then they're going to create the solution to the problem that they already created.
Right. We will make this worse, then we'll ride in on our white horse and save the day. Personally, I think Obamacare was a Trojan horse to get one-payer health care. Now, I know that gets off on another tangent, but they had to find a way to convince the general public that the government really has to step in and take over everything.
It's not a wild speculation. There are some insiders that have made
Sure.
that same claim.
Sure. Yeah. Anyway, I don't want to get off on that tangent necessarily, but you get the idea as to why direct primary care works. What DPC is simply a monthly membership, kind of like a health club, where you pay a small monthly amount to give you unlimited access to your doctor.
Without him having to worry about all the middleman
He's
stuff.
already been paid. Okay, well, think about this for a minute. Under our traditional system, what's called fee-for-service, right? The doctor really only gets paid when you're sick, right?
Kind of a conflict of interest.
It is, right? And a lot of care is follow-up care. And I don't want to cast aspersions on all doctors, right?
You work with a bunch of them.
I work with a bunch of them, and they're good people. They went to med school so that they could take care of people. But some doctor visits are there because they're not going to get paid unless they have a continual flow of patients coming in.
And that almost like the system perpetuates that. Like you maybe
Right.
didn't start off wanting to do that, but just getting worn down by the system year after year it becomes that.
Correct. That's part of it, right? And so what you have is a negatively positioned incentive to provide the care. In other words, if you keep coming back as often as possible, I make more money. Now, I don't think doctors do that as a matter of course, but nevertheless, that is there. But see, once you've already paid the doctor, you've flipped that incentive on its head. He or she has already been paid. Consequently, they have an incentive to keep you well. Does that make sense?
Yeah, keep you well and happy.
And happy, yes, so that you'll continue to come and patronize them whenever you feel sick, right? And not only that, they're also incentivized to make it as convenient as possible. So many direct primary care doctors, even not all, but a lot, offer direct access to them. They would rather have you text them or call them on their cell phone and say, I got this issue, can you solve it with a 5-minute conversation, right?
Right.
Then come into the office.
It returns us to the day of the home visit almost, but with modern
Yes.
technology.
Yes, you can do video visits, you can trade text messages, and obviously the regular voice calls.
Right.
But under the DPC model, it makes more sense for that to happen because you've removed all that negatively aligned incentive problem.
And that's good for both you and the doctor.
Absolutely.
Who wants to wait in the doctor's office and have to do all that and take a day off of work or whatever?
Right, right. So it really does make a lot of sense, and not just for the consumer. Think about this on an employer level, okay? If you're an employer who wants to offer a meaningful health benefit, this is one of the ways, partly because of that perfectly aligned incentive between the two parties to the care transaction. If you want to offer health benefit to your employees, this is a great one to offer. You know, a lot of employers understand that the more healthy my employees are, you know, the better production I'm going to get. A lot of them offer wellness programs, but they largely are focused on the individual's desire to go to the gym or, you know, utilize a health coach or whatever. They're kind of self-driven. Well, most of us are not that engaged in that. You know, we don't go to a doctor until we're sick, and that's okay, right? That's our choice. It's our freedom so far, right? But with direct primary care, now you have a healthcare professional, a doctor involved in prescribing that, pushing it, because the incentives are there for the doctor and the patient. It just works better than most wellness programs. There's not a lot of data yet to prove that, because DPC as a movement is still fairly young. But
You're just going off of critical thinking.
correct.
Leads you to the...
Logically,
It
that's
makes
the
sense.
outcome.
So you mentioned that you just brought this up. I didn't even think of this from a employer's perspective, offering it as a benefit to employees. It makes sense to you for the same reasons that it would make sense to an individual. If your employee has this program, then and he can just take care of a problem with a phone call or a text, they're not going to be taking time off of work.
Precisely. That's a great point. You make it convenient for the employee. He or she could be sitting at their desk with a 5-minute video visit with the doctor. They can do it on their break, or they can do it on their lunch break, and not actually have to take time off. Absolutely. It's a good point.
So it would make sense for not just an individual if they wanted to do this, but if a company wanted to have this as a benefit to their employees, it would probably be a big cost savings to them, even above the health insurance they might already be forced and compelled to
Correct.
provide.
Correct. And on a side note, when we launched our particular brand of this a few years back, we were really up against kind of competing issues, okay? Obamacare said, you must buy health insurance. It's now the law, and if you don't, you're going to pay a penalty, right, on your taxes. And so from a marketing standpoint, it was very difficult initially to go to somebody and say, buy our membership, right? When the government has a gun to their head saying you have to buy health insurance. The initial thought was, well, why would I buy health care twice, right? But the natural course of Obamacare in the end has played into what we're trying to do, because you've reached a point where health insurance, despite premiums going through the roof, the value that you're getting has gotten less and less and less, right? Spike in premiums, decline in benefits, either in the form of less covered services and or really high increase in deductibles, okay? Well, what we've come to is, all right, just embrace the fact that health insurance sucks at this point. I hope I can use that, right? Go get the worst plan you can find with the highest deductible, so your monthly premiums are low, and look at it like you would a car insurance policy. It's there for the train wrecks. Buy a membership for your primary care, the stuff you're going to use most of the time, right? And in most cases, the annual spend for that monthly membership for your primary care is going to be far lower than the total annual deductible with your health insurance. Let's go back to what health insurance or insurance should be, which is to cover catastrophes. That's the idea. And that's kind of where Obamacare has gone. It's forced people into this. Of course, many of them, they're looking at the premiums, even with a high deductible plan, and say, I can't afford that, right? So here's another concept, right? Enter the picture healthcare sharing ministry plans, okay? This is a fabulous concept that's been around since the 90s. In fact, it's been there long enough that it was grandfathered into Obamacare, surprisingly, right? Where you can join one of these Christian co-ops, essentially, where they pool their money to take care of each other with their health care. It's a legally recognized way to get your health care and have it exempted, or you be exempted from the health insurance individual mandate. And it works very, very well. It works on the provider side very similar to insurance. The same process is there where the doctor can send a bill or a claim to the particular ministry plan and have it paid. But what's different is there's no requirement to be in network. There's no credentialing requirement. You just pay it, right? There's no dickering over, you know, the procedure codes, the billing codes, right? Now, granted, they most of them start with Medicare and say this is what Medicare pays, this is what we will pay, and it's a flat percentage. But what's amazing about it is because they don't have all the overhead associated with how the insurance system works, they pay better to the doctor than what the doctor would get from an insurance company that also has a profit motive, mind you. Okay? That's another part I haven't mentioned. That insurance company is there to make money. And they're not doing this out of the goodness of their heart, right? Shocking, you know, right? Good old capitalism, which I happen to agree with.
Right.
But it is the truth, nevertheless, right? Well, these ministry plans, they're there to help each other. They're based on the Christian ideal of take care of your fellow man or woman, right? No profit motive, very low overhead, right? And an exemption from the individual mandate. So you're not dinged on your taxes for having one of these plans.
You're out of their government insurance thing, but
Correct.
it's another one of these kind of a way around, almost a nullification of sorts of the Obamacare program, because you're not participating in it, but at the same time you're not going to find yourself into trouble for not.
Right. You're actually given a religious exemption.
What you couldn't have by yourself. You'd have to be a part of one of these medical cost share type programs that they have out there.
Correct. And there's a bunch of them.
Right.
Right. There's probably half a dozen are fairly well known. One that gets a pretty good amount of press is called MediShare. There's one called Samaritan Ministries. There's one called Liberty Health Shares. Happens to be the one that we like to work with. In the Utah market, they don't all work.
Right.
There's this perception out there that Mormons are not Christians. Some faiths feel that way, and it's okay. You know, we still have freedom of conscience at this point. Freedom
of association. So some of those groups you got to be careful of because they don't allow Mormons.
They won't necessarily take Mormons.
Right.
Okay. Funny story associated with that. Okay. A couple of years ago, we went to a business conference for direct primary care. This is where we were introduced to this concept of a ministry plan. And there were two of them there presenting. They had their little booth right on the conference floor, and as luck would have it, I went to one called Samaritan Ministries at first. And when I realized in the course of the conversation that this represented an exemption from the mandate, the health insurance individual mandate, that wow, this is an answer to this idea that why would I buy health insurance when or membership rather, when I'm forced to buy health insurance. Well, this is great. About 15 minutes into the conversation, I say, we're from Utah. The major demographic is Mormon. Is that a problem? And he kind of rolls his eyes and he says, oh, I wish you told me that up front, because we won't take Mormons. Kind of ironic, given that the name of their group was the Samaritan Ministries Group. If you know the story of the Good Samaritan, right?
Right.
Nevertheless, he directed me across the hall to Liberty Health Shares, and they're fine with it. You do have to sign their basic statement of beliefs to join their program. It doesn't mean you have to be part of their church,
Right.
right? Incidentally, they happen to be a Mennonite church in Ohio, and seem like good people. You know, I don't know everything about how they believe, but in summary, their statement of beliefs say that you believe in the Christian ideal of assisting your fellow man bear his burdens, right?
That's pretty
I'm
basic.
good with
yeah.
that.
Right?
Right.
And that health care is between you and God and not the government. Now, I put that into my own words,
Right.
but in essence, that's what they're saying. Well, hey, sign me up, right? That's what I believe. Get the heck out of my life. That's what good government is supposed to be. Guarantee me the freedom to live my life the way I want to pursue my happiness.
Yep.
And then obviously, sadly, our country has really gone off the rails that way. But at least this is one thing where there is a small loophole, right?
So how do these medical cost share programs work with the Zenith Direct Care? How compared to Zenith Direct Care with an insurance company?
Well, in this particular case,
Would it be different for each health sharing thing?
you know, it probably would.
Okay.
I'm not as familiar with some of the others. Like I said, some of them wouldn't do business in Utah anyway because of the Mormon demographic. But at least with Liberty Health Shares, good people, by the way. I've had personal conversations with quite a few of them in their office, and they're just wonderful folks. They actually recognize that the care you get under a direct primary care doctor is better than what you get with health insurance. In fact, not only is a DPC doc going to focus on wellness, which obviously is good business for them, right?
Right.
I mean, they're not in it for profit, but they do want to
But the more money they have available to be able to share
Sure.
with other people, the more
Right.
it makes sense.
Yeah, the better. So, you know, that makes sense for them. But additionally, DPC docs recognize that because the majority of their membership are not going to be insured, and this is true of Zenith Direct Care, we've gone out and we've talked to specialists, we've talked to imaging centers, and when we refer people out, we know that in many cases, because they're not going to have health insurance, they may or may not have one of these ministry plans, right? We've negotiated low prices with those specialists. They understand that when we send them one of our direct primary care members for an MRI or whatever, that they're expected to give them the most favorable pricing. Well, Liberty Health Shares and these other ministry plans, they recognize that. More so Liberty than the others. To the extent that Liberty will actually pay for a portion of someone's membership with a DPC doctor. Well, that works really well for us, obviously. You know, we want people to sign up with us for our monthly membership, and so does Liberty. to the extent that they'll actually subsidize the cost of people signing up with us. Because it's A, it's better care, and B, it's lower costs overall for them, because people are not going to pay those really high prices.
And those specialists recognize too that they're going to be saving money not having to deal with a regular insurance company as well.
Generally speaking, yes. I will say that this concept of the ministry plan is still a growing concept. Not that many know about it. When we first looked into this, our first thought was, okay, if we go this route and we're going to encourage people to take on a ministry plan for all their care outside of our office, our first concern is, well, we've got to be sure that those doctors we refer to are going to take that as payment for their services. So when I got back from that conference, first thing I did, spend 2 weeks on the phone. Dr. So-and-so, this is what we're trying to do. Would you take this? And, you know, I'd say probably 80% of the time they'd never heard of a ministry plan.
Wow.
Yeah. But when I explained to them that they didn't have to be in network, they don't have to be credentialed, they don't have to negotiate, and Liberty is going to pay them 160% of the Medicare fee schedule, they're like, heck yeah, sign me up, right? I mean, to give you some kind of a comparison, in primary care, well, I already mentioned we always start with Medicare, and I think that's how it is for the specialists. I'm doing a jig on my desk if I can convince a commercial insurance company to pay us 115% of Medicare. That's fabulous. Most of the time, we're looking at somewhere between 105 and 110%, right? Liberty, if we were billing them a more of a fee-for-service kind of deal rather than a monthly membership to the member, if we were billing them directly, they would pay us 150% of Medicare because they can. They're not paying all that overhead, and neither are we, right? Consequently, when you have that conversation with a business-savvy doctor, they get it. Heck yeah, sign me up. It just works really well.
These are two options, even working really well together, of being able to get individuals and businesses out of this grip on our lives from the government through healthcare.
Correct. Now, there's a few things that unfortunately are still roadblocks, okay? Obamacare has a mandate in it that requires larger employers to offer health insurance.
So larger employees can't offer the cost sharing?
Any employer that has 50 or more full-time equivalent employees has to offer health insurance. Now, I'm not a lawyer, I'm not a tax accountant, I don't completely understand. I can get that part, right? If I'm not mistaken, I think that they just have to offer it. Doesn't mean that the employee has to take it necessarily. But there's a certain requirement for a certain number of or percentage that have to take it in order for the employer not to get penalized by the IRS. You know, exactly where that lands, I'm not sure. But in those kinds of situations, it gets a little more difficult.
For the health sharing, but at least they can still do the Zenith Health Direct because
they can.
That makes a huge difference.
Exactly. And go back to, 10 minutes ago, embrace the suck of health insurance, right? And go buy that crappy plan.
Right.
And then buy a companion primary care membership so that, they've got the comprehensive thing. We've got a few companies in our corral at this point, and what I'm told is that they love the fact that they can come see us anytime they want. It's convenient if they can't come in, well, they communicate, But if they do come in, they can come see us 5 times in a month, and it's not going to cost them any more than it would if they saw us once. There's no limit on it.
Wow.
We do charge a $10 visit fee when they come, but compare that to, $40 for a copay or whatever, and compare that to 80% coverage when you use your insurance.
Most people aren't going to be doing this 5 times a month, and so it's no big deal.
No, it's no big deal. But from an employer standpoint and an individual standpoint, it's predictable. It's not going to break the bank, right? And we're talking rates that, depending on the age, for Zenith Direct Care, we're talking $9.95 a month for children. So 0 to 17. We try to make it as family friendly as possible. 18 to 39, $49.95 a month. $69.95 a month from 40 to 64, and then 65 and above is $89.95 a month.
Because you're going to be seeing them more, so it just makes sense.
Yeah, of course.
Yeah.
Now, we have next to none that buy our membership in that higher age bracket, because at that point they're on Medicare, and they figure Medicare, and they're right. They paid into the system. They might as well, get the value of it. But whatever. Yeah, right. And that's a whole nother discussion, right? Yeah, Medicare. There's a reason that a lot of doctors don't take Medicare.
Yeah.
Because the truth is, when that makes up a huge percentage of their business, they can't stay in business.
Right.
They just can't do it. The overhead is too much. The money coming in for their services is too small. And so, yeah. Anyway, so if I could use a comparison, we strive to be the Walmart of medicine.
In a good way.
In a good way. Yeah, well, yeah, to all those out there that don't like Walmart, you have to admit that Walmart is cheap. It's affordable. I don't like the word cheap. Affordable, right? The idea of this type of medicine isn't new. I mean, it's been around for years and years. In the beginning, it's been referred to as concierge medicine. We don't like that term. It implies that it's only for the wealthy. And
concierge medicine at a Walmart price.
Exactly. If concierge medicine is the Tiffany's of healthcare, we strive to be the Walmart of healthcare. That the common man can afford, or the small business employer.
But with the higher quality, as opposed to the lower.
Yeah, exactly. There's so much out there in the medical field about physician burnout.
Oh, really?
Yeah.
Huh.
There are decreasing numbers of doctors going into the primary care field.
They're doing more specializations?
Yes,
because
they do not want to deal with this. Statistically speaking, primary care doctors have to see 3 or more patients every hour to cover all the overhead of insurance-based care and still make a decent living. I wouldn't go to med school and be in residency for 4 years after that if I had to do that. And it's a known thing. So ever decreasing numbers of doctors are signing up to do primary care. Well, that spells a shortage in the future. And we're already there to a large degree.
And you can kind of see that. I don't know what the equivalent here in Utah would be, but I lived in California for a little while, and they've got this thing called Kaiser.
Yeah, sure.
And it's like
a monster.
It's that thing where like they've got to see maybe 5 in an hour to do their job, and they're just like in and out. They don't care about you. They're like, you got a headache, we'll put you in chemo tomorrow.
Right.
No, they don't care what you got. They're gonna, and so, but before that, I had because I can attest to this Tiffany's of medical coverage that Zenith has, because the doctors are just awesome, and I know that firsthand. And so experiencing Zenith compared to the Kaiser, I don't know what the Utah version of that would be, but is just a huge difference.
Yeah, the comparison, I won't spell it out, but it starts with an I and it ends with a C, right? It would be the Kaiser of Utah.
Gotcha.
And not to cast too many negative thoughts in that direction, they do provide great care, but they're kind of the gorilla in the marketplace. and they want to control everything from the ground up, you know. And another not very well-known fact about primary care, from the business side, a lot of these large groups, hospital/insurance groups, they employ their primary care division at loss. They don't make money at all in primary care.
It's like a loss leader that gets you in the door for that. And
Exactly, and the reason they can do that is because those primary care docs are feeding referrals to all the high-priced care.
which could also be considered maybe a conflict of interest if your employment might depend on or
A
encourage.
conflict of whose interest? That's the question.
Right.
The patient's interest. You know, and so when you have these large groups that can pay, you know, their primary care doc at a loss to them for whatever primary care services they provide, because they know that that doc is gonna feed referrals to the specialists in the ER and all those things. There's a problem there as well.
Mhm.
You know, you've got this collusion that isn't always in the best interest of the patient.
Even if it's not stated collusion, even it could be,
Correct.
you know, in the back of your mind or just the course of events.
Right, right. Incidentally, on a related note, the doctors that are going into this form of doing medicine, this direct primary care movement, are the independent doctors. And independent primary care physicians are a dying breed, partly because of this burnout that we talked about. You know,
So are more of them going into this membership?
Well, those that
Okay.
want to stay independent, they've reached a crossroads. They're saying, I can't live this way anymore. I get home at the end of the day, I'm burned out because I'm running patients through my office like cattle just to pay the bills and make a decent living. And I come home and I'm tired. I don't have any energy for my family, let alone live a decent life, you know. And so they're either giving up their independence and signing up with these large groups because they know that they're going to get paid higher wages, you know, or they say, no, I want to stay independent, but I'm going to make some changes to the way I practice medicine. You know, I'm going to do this membership model, and I'm going to have a decent living. I will be able to focus more on my patients. I can see one an hour if I want. Or
Spend the time that you need with that person.
Exactly, because they've already been paid, right? You flip that incentive on its head. You know, they have an incentive to keep you happy and healthy, and they can live a good life. Now, some of the detractors are going to say, well, that just makes the shortage of or primary care physicians worse. And in a sense, that's true. But at some point, you have to attack the underlying problems for why doctors are not going into primary care. And if you can return to the idea of a good living, doing what those doctors love to do, and that's help people, then eventually the problem fixes itself.
Well, that's one of the things. It seems kind of like an odd thing to blame. It's almost like blaming the victim for the problem.
Correct.
You've got the government making things harder, and so a doctor decides to say, oh, let's do something where I don't have to deal with this anymore and provide better care. And to say that that's the reason why I mean, it just kind of it doesn't seem, maybe it's almost circular or
Yeah.
Putting the blame in the wrong place, at least.
Yeah. Yeah, exactly.
So you've been doing Zenith Direct Care for how long?
About 3 years since we had our pricing figured out, some of our marketing, et cetera. Like I said earlier, we didn't get a lot of traction at first. Where we really hit the gas pedal was last fall during open enrollment. Okay? And across the board, and the listeners will know this, they're consumers, everybody experienced huge health insurance increases in their premiums, right?
With the Affordable Care Act.
Correct, the Unaffordable Care Act, right? And a little side note, the reason for that, well, this is something a lot of people don't know. When the Affordable Care Act was passed, it was largely passed because of insurance company lobbyists. I mean, think about it. If you have the government pointing a gun at you saying, you will buy this product, whoa, let's support that, right? And so there were a number of large insurance companies that said, yeah, sign us up. Well, there was some corresponding give and take there. You know, the government said, well, you're going to have to take everybody with pre-existing conditions. We're not going to let you exclude people. Okay. And some other things. But also, the insurance companies saw that and said, well, okay, but that probably means we're going to lose a lot of money, at least in the early going, until we have all these younger folks, healthy folks, sign up that are going to pay for the train wrecks that come and sign up, right?
Almost like a Ponzi scheme.
Sort of. And by and large, the insurance companies did lose a lot of money. But the agreement with Obamacare behind the scenes was that for the first 3 years, the federal government would cover those losses. Most of the taxpayers don't know that.
I never heard that before.
Yeah, true story. Well, last fall, the gravy train for the insurance companies ended. 2017 is the first year where, with those Obamacare approved plans, they had to sink or swim. Well, that's why our insurance company, had we stayed on it, was charging a 58% increase in premiums. Our premium went from, I want to say it was $1,065 to just under $1,600. Well, that's less. That's about $100 less than my mortgage payment.
It's almost like you just might as well just put that in the bank and
Yeah.
you'll cover yourself if something bad happens.
Asinine, right? So, my own comparison between going with that plan, which was an 80% plan, okay, the deductible was $3,000 a year.
And the average person, they would never be able to get enough health care
To ever,
pay for that.
generally.
Yeah,
Right.
the average person.
Right, right. And there's this thing called max out of pocket, right? Because you understand that with health insurance, most health insurance, there are the so-called Cadillac plans, but with most people, it's going to be 70% coverage, maybe 80%. If you're really lucky and have enough money to pay the premiums, maybe 90%. That reciprocal percentage, 30, 20, or 10%, that's called co-insurance, meaning you have to pay for that out of pocket, right? So the plan covers 80%, you pay the other 20%, okay? Subject to your deductible.
Right.
Right? But because that's there, that co-insurance requirement, we have something called the max out of pocket. So we have, this is our plan that we would have had we stayed with it, a $3,000 deductible, but with a max out of pocket of 10 grand, which in essence means it might as well be a $10,000 deductible,
Right.
right?
And you're still paying the
And I'm
$1,000 a month.
still paying almost $1,600 a month had we stayed with
That's
it.
just crazy.
Asinine. And go out and buy another house.
Almost cheaper just to pay the fine.
Oh, yes, yes. Well, last year, the convergence of the cost of the premiums and the fines were getting closer, and people started saying, well, if I'm going to have to pay that much in taxes for ignoring it, I might as well get some coverage. And it just so happened last year in November, I got a phone call from KSL. They say, hey, we found you out there. We want to know about this. 3 weeks later, we're on the 10 o'clock news, and then the phones are ringing off the hook the next day. And On average, I'd say that with this concept of combining a ministry plan with our membership, people are saving 50%. The comparison in some of our marketing materials is 66%. Not made up numbers, real, genuine numbers. You know, and people are saying, hey, that makes a lot more sense. I can actually afford that. I can actually still afford to eat, pay for the lights, pay for the heat.
And you get better care.
And you get better care, a doctor that's more responsive, you know, it's just better all the way around.
So before you were doing this, you guys were doing just the traditional general care.
Right.
And how long have you been doing that? Leads to a question that I've got.
Yeah, well, our 3 clinics, the first one opened in '96.
Okay.
The second one in 2008, and then the third one in 2015. And so, you know, I don't know. Our oldest one has been in operation for 21 years.
So in that 21 years, have you seen more and more, just like slowly 1 year at a time or something like that, government, state, national levels getting more and more into controlling what you're doing, which leads to
Absolutely. Yeah, because again,
not just Obamacare, just in general. Just
in
government.
general.
Yeah.
Yeah, absolutely, and they exercise that control via the Medicaid and the Medicare system. It's gotten harder and harder and harder, you know, via stuff that is excluded from that insurance, that government insurance. And not only that, things like pre-authorizations. In other words, you go to the doctor and he says, well, you need to get this done, and I can't provide that, but so-and-so doctor can. The insurance companies, and especially Medicaid and Medicare, are saying, well, you have to get authorization from us to get that done. It doesn't matter that your doctor feels like this is important. You have to get our permission or we won't cover it. And that's just one example of intrusion, you know.
Which leads to worse care, higher prices, the whole thing. Just like, I mean, can you imagine if, you know, the government passes a law, you got to go to Walmart. You think Walmart's going to increase their quality and lower their prices? I mean, it's going to be,
No.
It's just what happens with monopolies.
Right, right.
And so you can see how people complain about, we need the government involved because the prices are so high and the poor people can't afford it. Whereas if you look at it, actually, what's the cause of the problem is actually the government getting more involved
Correct.
in the patient and the doctor's
Correct.
healthcare choices.
And it's just another example of our well-meaning politicians that create a problem that they can then solve, right, with later legislation that only makes the problem worse, so that they can come again later and solve it by making it even worse. Yeah.
Each one leads to a further problem that's got to be fixed.
I really think that this is the Trojan horse for single-payer healthcare.
Right.
Government-run healthcare. Socialism. That's where we're headed.
Right.
And for any doctors that might be listening to this, independent doctors or would like to be independent, we need to join forces. You know, we've aspired right from the beginning to not just be our group doing this, but to link arms with other healthcare entities, direct primary care entities, to offer a network of DPC docs that have together some legislative clout, you know. Incidentally, on that subject, DPC as a movement has grown up a lot in the last few years. I mean, there were some heavy hitters in Washington State, a few others around the country that have been in this for a dozen years that kind of pioneered the concept. But because it's gotten steadily worse because of Obamacare and increasing regulation, there's an ever-increasing upward curve, if you're looking at it on a chart, of independent practitioners running into this. Most of them just don't know where to start. You know, you kind of have to dig deep to find somebody out there that's kind of been there and can offer a helping hand. And Fortunately for us, I ran into the right person at a conference about 5 years ago. Wish I remember his name. I remember he looked like Vladimir Putin. So Mr. Putin, he referred me to a conference that was going on. In fact, fun story, I was at this conference purely to try and run into somebody that could tell me where to start. Couldn't find anybody. In fact, I arranged a conversation group before the conference. Hey, we're going to meet in this room at this time to talk about this issue. And it was like a whole bunch of deer in the headlights. Like, well, I don't know, you know. And
Can you do that type of a question? Like, is that like just not realizing it can be done, or what was the I don't know?
Well, my question at the time was a little more generic in nature. It was this, hey, we're stuck in this ridiculous health insurance world. What do we do? How do we get out of this? And nobody had any really good answers, but I happened to sit down next to a guy, and he says, hey, I know about this group. They have a conference going on in, I think it was St. Louis. And their conference is this weekend. And here I am, it's like a Monday night, and I'm in California at a different conference. So you go back to the hotel room that night, and I get on the phone, I'm excited. I talk to the owner partners in the clinic. I says, hey guys, I know you just dropped $3,000 on a conference, the one I'm at, but do you mind dropping another couple thousand on another conference? And I actually ditched that conference, drove home early so that I could get on a plane to St. Louis
Wow.
in time to catch the other conference. It was like a breath of fresh air. I found 200 or 300 people that were asking this same question, how do we get out of this? And that happened to be the inaugural conference for this group. They are the Family Medicine Education Consortium, FMEC, that was sponsoring this Direct Primary Care Summit, they called it. And in the 5 years since that's transpired, they now have sponsorship by the American Academy of Family Physicians. And that's just one group. There's something like 15 different medical societies that are now sponsoring them. And they're getting grant money directed in this direction. And a month ago, they organized a bunch of us, I was one of them, in a mob. The conference was held in Washington, D.C., and we all went up on Capitol Hill to talk to our senators. I was in Mike Lee's office talking to him about this. And fortunately, Mike Lee is way ahead of the curve. Great senator. Really has our best interests at heart. That's my opinion. Understands this concept. But that's just an idea of how the movement has grown up. It's gaining steam in Washington. And with the new administration and our new Health and Human Services Secretary, Tom Price, who happens to be a family doctor.
So he knows where it's coming
gets
from.
it.
Yeah.
Oh yeah, he gets it. It's very exciting for us. And I would love to talk to some other doctors. If they're listening to this, call me. Zenith Direct Care.
I know we've got a few, so
Yeah. zdirect.care. That's our website. Look us up. Call the number. I'll talk to you about it.
Awesome. Well, I think that's, I'm going to have you say anything else you've got to finish, but I hope that all of our viewers and listeners will check out Zenith Direct Care at zdirect.care. So not .com, zdirect.care. So it's a little bit different than your regular websites out there. So it's zdirect.care. And look at putting together one of these things, like with the cost sharing, along with these memberships, to be able to save money, get out of the government intrusion, and be able to have better health care. Just
Right.
To me, it just makes sense.
Right, and along with the Christian ministry concept, feel good about helping other people. It really is based on that concept. You know, that to me as a practicing Christian matters to me. You know, not only that, they're not going to cover stuff like abortions, you know, birth
Yeah.
control, you know, things that I don't agree with, you know. If people want those things, they can pay out of their own pocket, not out of my pocket.
Right, that's kind of the goofiest thing, is to
Yeah.
make somebody else pay for
Yeah,
those things is just crazy.
right, right. So it really is feel-good medicine on many levels, economically and just for the care that you get. It's a good idea.
Well, do you have anything to share with us before we sign off?
No, just to thank you for the opportunity, and I'd love to talk to you if you want to give me a call.
Great. Thank you, Aaron. We got Zenith Direct Care. I'm Ben McClintock with Defending Utah. Till next. Don't forget to subscribe to the Defending Utah YouTube channel. You can also find us on Spreaker, iTunes, and iHeartRadio.